What daily masturbation does to your prostate. You won't believe it. Imagine this. It's 3 a.m. You wake up for the third time to use the bathroom. Your prostate feels swollen, uncomfortable, and your doctor just says it's part of aging. But what if something as simple as your sexual habits could quietly be influencing your prostate health for better or worse? Recent studies from Harvard and the European Urology Journal reveal something shocking. How often men release, even through solo activity, may change their risk of prostate problems, including cancer. Yet, almost no one talks about it. Today, we're diving into what daily masturbation really does to your prostate, the science, the myths, and what doctors are now discovering. Stay with me till the end. There's one finding that completely surprised even researchers. And tell me in the comments how old are you and how's your prostate been treating you lately? Let's start simple. Your prostate is a small gland about the size of a walnut sitting just below your bladder. Its main job, to produce the fluid that carries and nourishes sperm. But what most men don't realize is how sensitive this gland is to hormones, lifestyle, and yes, sexual activity. As we age past 50 or 60, testosterone levels naturally decline. At the same time, another hormone called DHT, or dihydrotestosterone, can rise inside the prostate. DHT is powerful. It can make the prostate grow larger, which is one reason so many older men experience symptoms like weak urine flow, frequent nighttime urination, or discomfort when sitting. Now, here's where it gets interesting. The prostate isn't just affected by hormones or diet, it's also influenced by how often it's emptied. Researchers at Harvard followed over 30,000 men for nearly 2 decades. They found that men who ejaculated more often, around 21 times per month, had up to a 33% lower risk of prostate cancer compared to those who did so less often. Scientists believe that regular release may help flush out inflammatory compounds and toxins that build up in the gland. Think of it like maintaining a small engine. If it sits unused too long, the oil gets thick and the system starts to clog. Moderate regular activity seems to keep that system clean and balanced. But before you rush to conclusions, no, more isn't always better. We'll get to that later. The key is moderation and understanding why balance matters for prostate health. Most seniors were never told this growing up. It was considered a taboo topic. Yet now, modern urologists and endocrinologists are saying this is a natural function with potential health benefits, especially when it's not driven by addiction or stress, but by normal physiology. So, the takeaway from this section is simple. The prostate is an active living gland. It responds to your hormones, your circulation, and your habits. Regular moderate release, whether through intimacy or solo, may actually be protective, not harmful. And this opens a powerful question for you. Have you ever noticed your urinary symptoms change during times of higher or lower sexual activity? Drop a comment below. Your experience could really help other men watching this. Myths versus facts. What daily habits really do to the prostate? Let's clear the air, because this topic is surrounded by decades of confusion, myths, and even guilt. Many men over 60 grew up hearing things like, it weakens you, or it drains your energy, but science paints a very different picture. Here's the truth. Your prostate doesn't care why you ejaculate, it simply responds to whether it's being used regularly. Myth number 1. Masturbation causes prostate enlargement. Fact. There's no evidence supporting that. In fact, as mentioned earlier, Harvard researchers found that men with more frequent ejaculation had a lower risk of prostate cancer. It may help reduce congestion inside the gland, preventing inflammation and stagnation of fluids. Myth 2. It weakens testosterone or causes fatigue. Fact. Normal, moderate sexual activity doesn't lower testosterone levels in healthy men. What actually lowers testosterone is chronic stress, poor sleep, excess alcohol, and being sedentary. Studies from the Mayo Clinic show that brief sexual activity doesn't deplete hormones, it's the mental stress around it that causes fatigue. Myth on 3. Daily release means addiction. Fact. Context matters. For some, frequent self pleasure is simply a part of maintaining prostate and sexual health. For others, if it's driven by anxiety, boredom, or compulsive behavior, that's when it becomes harmful. The difference lies not in the act itself, but in why it's being done. Doctors now view masturbation as a neutral to beneficial behavior when balanced and understood as part of overall wellness. Urologists even recommend it for men with prostate congestion to improve fluid circulation and relieve discomfort. Doing it daily is not automatically good or bad. For some, it can maintain prostate drainage and reduce pressure. For others, especially those with fatigue, medication side effects, or low testosterone, it may feel draining. Your body gives you signals. If you feel more relaxed, sleep better, and have less prostate discomfort, that's a good sign. If you feel fatigued or mentally foggy afterward, you may be overdoing it for your current health level. So rather than guilt or extremes, the message is balance. Listen to your energy, your mood, and your urinary comfort. Question for you. Have you noticed if your energy or sleep changes based on how often you release? Share it in the comments. It helps other men realize they're not alone in this experience. 3. How healthy circulation and hormone balance protect your prostate. After 60, circulation slows and hormone ratios shift, blood flow to the prostate decreases, and testosterone drops slightly while DHT rises. Simple habits helps. Walking 20-30 minutes a day boosts pelvic circulation. Hydration keeps fluids thin. Strength training stimulates testosterone gently. Deep sleep resets hormones. Poor sleep can lower testosterone 10-15%. Nutrition also matters. Lycopene from tomatoes and zinc from pumpkin seeds or seafood support prostate health. Have you noticed that on days you move more or sleep better, your prostate symptoms seem calmer? 4. Foods and nutrients that calm prostate inflammation. Inflammation is silent but powerful. Certain foods reduce it. Lycopene, cooked tomatoes, tomato paste, roasted red peppers. Cruciferous veggies, broccoli, cauliflower, Brussels sprouts contain sulforaphane, zinc, pumpkin seeds, oysters, lentils. Omega-3 fats, salmon, sardines, flax seeds, walnuts. Avoid processed meats, fried foods, and excess alcohol. They promote oxidative stress. Which of these prostate-friendly foods do you already enjoy? Tomatoes, broccoli, or salmon? 5. How stress and sleep affect prostate health. Stress and poor sleep affect nerves, circulation, and hormones. High cortisol constricts blood vessels, tightens pelvic muscles, and increases inflammation. Daily deep breathing or meditation improves prostate comfort. Sleep 7-8 hours to boost growth hormone, testosterone, and melatonin. When do your prostate symptoms seem worse during stressful weeks or restful ones? 6. The role of movement and exercise in prostate health. Circulation is key. Sitting too long can make the prostate congested. Walking, swimming, light cycling improves blood flow. Pelvic floor exercises strengthen bladder support. Hip and lower back stretches release pressure. Even short daily activity makes a difference. What kind of movement do you enjoy most? Walking, swimming, or stretching? 7 warning signs. When to see a doctor. Pay attention to frequent nighttime urination, weak or interrupted urine flow, pelvic pressure or discomfort, blood in urine or semen, sudden changes in bladder control. Most issues are benign, like BPH, but early detection makes treatment easier. When was your last prostate checkup within a year or longer? 8 natural lifestyle habits that keep the prostate young. Hydrate. Water and herbal teas keep fluids thin. Balanced diet, anti-inflammatory foods, less processed food. Move daily, circulation and hormone support. Manage stress, meditation, breathing, quiet time. Sleep well, 7-8 hours nightly. Routine checkups, PSA and exams. Mindful sexual health, balanced and moderate. Which habit will you focus on first? Hydration, movement, or sleep? Your prostate responds to every lifestyle choice. Small, consistent changes make a huge difference over time. Which food will you add this week? Tomatoes, salmon, or pumpkin seeds? What's your favorite way to move? Walking, swimming, stretching? What prostate or senior health topic would you like next? Subscribe. Without it, you'll miss the next breakthrough video. Your like helps more seniors discover these tips. Comment. Your answer may inspire someone else today. Remember, it's never too late to support your prostate. One small action today can improve your comfort and vitality in weeks, months, and years.